interpreter, could not join us here today, but we will make our transcript available for all those who request it following the press conference. With that, I'm going to turn it over to Commissioner Chibinette to give us a public health update. Commissioner.
Thank you, Governor. Today we are announcing 71 new cases of COVID-19 for a total of 1,211 cases. We are also announcing an additional new confirmed deaths today for a total of 34. One female over the age of 60 at Hillsborough County and one male over 60 in Rockingham County. Today, I'd also like to announce 3 additional outbreaks in long-term care or residential facilities. The first one is the Institute for Professional Practice at Concord, New Hampshire. They had 2 residents, one in a residential program, one in a day program, that tested positive for COVID-19. Unfortunately, they had 1 client death in that program. They also had 6 staff members infected. They have not had any positive cases for several days. The second one is the resident at Salem Woods in Salem, New Hampshire. They have 21 residents impacted and 4 staff members. And Bellamy Fields in Dover, New Hampshire, with 5 residents impacted and 5 staff. A couple of things that we are continuing to do that I'd like to highlight for our long-term care facilities. Our MMRS, or our Mobile Response Clinic, is still responding to long-term care facilities. Those response. So essentially, what we're doing is when we find a positive case in our long-term care facilities, we're sending our mobile team to take specimens if the facility is not able to do that themselves, and we are testing all of the residents in that unit or in that facility, depending on how large the outbreak is. What that's enabling us to do is find our asymptomatic carriers, and some of the outbreak numbers that we're reporting today is reflective of that expanded testing. We are seeing regular patterns of asymptomatic residents in our long-term care. The best place to fight this virus for long-term care facilities is literally at your door. Be sure to request appropriate testing before any of your new admissions. Set up special areas for admission so that you're able to quarantine new residents into your building, and have a very low threshold for staff sickness. Really relay to your staff that those active screening questions are very important, and if they are feeling unwell at all that day, that they should be excused from work. We are still planning on Convenient MD deploying on Monday to test any staff member of long-term care facilities across Hillsborough and Rockingham County. And in addition, we are partnering with the 12th Civil Support Team to deploy an Abbott ID machine next week for point-of-service testing. So what that is a mobile lab that we take our new Abbott ID machine that has a 5-minute turnaround. And we are going to be able to deploy that to a variety of settings, community, long-term care facilities. Most likely our focus and our priority is going to be around vulnerable populations and long-term care facilities. It typically has about a 5-minute turnaround on those tests. So as long as we maintain our supply levels from our federal government, we will be able to do point-of-service testing for our long-term care facilities. It's very important. Right now, we have enough supplies, enough test kits to start that process so that we get a good start next week. But in order to continue and to sustain that testing process, that enhanced testing for our community and our long-term care facilities, we will need additional testing supplies from our federal partners. That's all. Thank you.
Thank you, Commissioner. Announcements like this are always tough. Our hearts are definitely go out for the families of a lot of the folks who have lost individuals out there. It is in some hands that it is refreshing to see that the numbers are escalating like we had seen over the past few weeks. They appear to have plateaued, but they're not going down. They really aren't, and especially in some of these long-term care facilities where some of our most vulnerable citizens and family members are, we're still seeing the mortality rate unfortunately take its toll. I want to talk a little bit today, revolve the rest of my comments around education. A month ago this day, school districts across the state transitioned into remote learning. And Education Commissioner Frank Edelblut assured us that the state was going to be ready and prepared for that challenge, and he was absolutely right. New Hampshire has set itself apart from the rest of the country. We've talked before about being the gold standard for remote learning. And what our superintendents, our principals, our teachers have done to allow that opportunity for our students is quite incredible, because there's states all across the country where that they don't have that opportunity like we do here. Parents and students alike have embraced it in a variety of different areas. It's been an all-hands-on-deck effort, and we just want to say thank you to all those who have brought that success to our kids across this entire state. There's always challenges with that system, and if you look at some of the ancillary programs that we put into place, whether it was food insecurity programs, special education programs, a variety of different pieces to that whole education puzzle. It wasn't just the remote learning, it was really all the other pieces that make remote education such a success. And in most areas we were successful. In some areas there were some stumbling blocks as we moved forward. But again, compared to New Hampshire to the rest of the country, it was phenomenal. I've talked to governors across the state that just had to, unfortunately, they couldn't handle and weren't set up for that remote learning opportunity, and they had to just basically send their kids onto vacation, summer vacation for the rest of the year, and that's going to create problems for the long run. And what we need to do is make sure that as we continue through remote learning, and that's what we're going to do, continue remote learning through the end of the school year as of today. And talk about what is going to happen for remote summer school programs, what September is going to look like. There's a lot of unknowns there, but we do have resources to tackle a lot of those challenges. We took the biggest challenge that we could imagine head on, and we were very successful with it. And given, I think, everybody's sacrifice and dedication to that effort, I firmly believe that there's nothing that we can't handle as we move forward. When making this decision, again, it's not easy to make the decision to tell students and parents that they are going to be out for the rest of the year. You have to be cognizant of the senior class, let's say. Graduation is not going to look like it does for them as it did for maybe their friends that had come before them. Senior prom, all those types of things, unfortunately, are going to look very, very different. And the students are going to have to find other innovative ways to proceed along with those graduations. When you look at remote learning as well, I would just want to talk about summer programs. As they continue, we'll be challenging ourselves to extend those summer programs, see what they might look like. We'll have the tools and resources to make those available to students in a variety of ways. And we want to make sure that, given this very different dynamic, this very different course we set our students and our parents, our teachers on over the past couple months, and will continue through the rest of the year, we need to make sure that when we go to enter into September, it's not going to look like a normal September. We may need to make sure that if there are gaps, if there are children who maybe didn't complete or get far enough along with some of their curriculum as we had hoped, that we have the resources there to fill in those gaps, to help them catch up. So there's going to be new norms all along the way throughout this process. But when we looked at all the different models to try to make this work, there were none that really allowed for the physical distancing and to ensure that the mitigation of the virus in an asymptomatic way between children could be prevented. What we know now that we didn't even appreciate to the level that we appreciate now is that the asymptomatic transmission of this virus is very prevalent. You could have an entire classroom of kids passing COVID back and forth without a single symptom, without a sniffle. You wouldn't even know it. And for those kids, luckily, it doesn't seem to affect the younger population as severely as it does the older population. But we know those kids would likely be taking it home to their parents, to their grandparents, and causing another surge, another outbreak that, again, we just cannot risk. As I have been saying all along, public health has to be a preeminent variable in our decision making, and in this case, it absolutely was. Again, we just want to thank everybody for making a lot of these sacrifices, taking these challenges on. I think our folks at the Department of Education have done a tremendous job. The folks at a very localized level have done a tremendous job. We're going to be looking to get all that feedback in. And again, our hope is to get back to a new model within the classroom in September. Again, we'll have to see where we are. That's a long ways off. We've only been in this epidemic battle for about 5 or 6 weeks now. It seems like a year, but it really has only been been about 5 or 6 weeks, and it has changed day to day, moment to moment. And I think as a state, we've handled it very, very well. I couldn't be more proud of the citizens of the state and the sacrifices that they've made, the families have made, workers have made. Everyone's really changed their lifestyle, if you will. And in some ways, in many ways, the decisions we've made have been very severe on families and family dynamics and workplace dynamics, income dynamics. So we appreciate all those sacrifices, and especially when you're talking about remote learning and the sacrifices that a lot of families have made. The parents that are spending hours, many, many hours with their kids in many different levels. I speak for myself and our own family, that we have a first grader and an 8th grader and a 9th grader, and very different systems, very different ways of doing remote teaching, but adapting to it. It's been tough on a lot of parents, and we understand that. So we appreciate that their sacrifice and their efforts as we continue through the rest of the school year. With that, we can open up for questions. Yes, sir.
Private schools such as the Birch Tree Center in Portsmouth and Manchester are serving special needs population. They are funded through school districts. Will they be eligible for the remote learning as well? Because I don't think they are right now.
Well, if a private school is doing remote learning, and I believe most of them are, they can continue that. Are you talking about through the summer?
Up through the end of the school year.
Yeah, through the end of the school year. Again, we're advised. Our public school system is going to and all schools, I should say, I'm sorry, are going to remote learning through the end of the school year. So that's public and private schools. Sorry, I just didn't understand the question.
What kind of leeway is there going to be on, I mean, this is kind of down in the weeds, but on pass-fail, on the ability of students to complete this grade, especially for the older kids?
No, it's a great question, and I appreciate you bringing it up. You know, we want districts and principals and teachers to use as much flexibility as possible when it comes to grading. One thing we've appreciated is that the grading as it's done in a classroom is very different than the grading and the assessments that can be done in remote learning. It's a completely different atmosphere, a completely different situation for these students, a completely different way of absorbing the curriculum. Some students thrive in a remote learning situation, some students don't. And so we're really encouraging all the school districts to provide as much flexibility, go to a pass-fail system if they'd like to do so. You know, one thing I was talking to a junior. She was a little concerned because she's a great straight A student, and was a little concerned that because she doesn't work as well in the remote learning atmosphere, she was afraid that her GPA would be hurt by this. And that's very appreciated because she wants to apply to colleges and all that sort of thing in the coming year. And that's so again, we can't mandate it, but we're really encouraging districts to use as much pass-fail flexibility as they can. We don't want kids to be unnecessarily held back or anything like that. We want to move these kids along. We're going to provide some resources to close those gaps, get kids up to where they need to be from a curriculum standpoint, get the ancillary programs of special ed and whatnot up to where they need to be as well. Provide a lot of those programs over the summer as is expected in a remote learning way. But again, that flexibility I think is really paramount. It's up to the schools what they want to do. The state cannot mandate a specific grading system, but again, we want to encourage the flexibility for those systems. Get the kids moving along. Make sure that there's accountability in that system, but with as much flexibility as we can possibly manage.
Do you get to call an end date to the school year? Is there going to be a specific one, or is it going to be like it usually is with districts might go
yes.
variable? So
the question is, when would the end date for the school year be? Each district will still determine their end date. It might depend on whether they allowed for April vacation or not. There are still days off, even with remote learning. There's still weekends off. I think some districts are doing half weeks for April vacation. Some are taking the full week off. So districts will still determine their final end date.
Governor, you talked about gaps, and Education Commissioner Edelblue and some on the Board of Education have talked about the idea of a special assessment in September to determine how achievement was across
Sure.
the board. What do you think of that?
Sure. So the question revolves around the concept of doing some type of special statewide assessment to see where the gaps were across the state for various grade levels. I'm not against that by any means. I think it's given that we're going to have such, I think, close to 3 months of remote learning. In many areas, it's gone very, very well. In some areas, they've had a few more challenges, but it has been done across the state. And doing some type of assessment, again, we can look at that opportunity, and I think that'll be explored over the summer, just so teachers have an understanding of where the kids are. We know where those gaps are, and then we can provide the resources to fill in those gaps specifically for those students.
Do we know about SAT, PSAT test taking?
That's a good question. The question is about SAT and PSAT testing. I'm not sure what their schedule, how This decision doesn't directly affect that schedule, but would have to ask those organizations that administer those tests if they're making any adjustments to their schedule as well. And I apologize, I don't have that answer for you.
The question is about something totally different. If people want to move on. So the Governor Governor Cuomo in New York has announced extending the shutdown to May 15 for the New England
stay-at-home order?
A stay-at-home order, yes.
Yes.
What are your thoughts on that? And you've said that you want to give at least 2 weeks' notice. I think you've said in the past. We're getting close to May 4th. When are you going to decide what New Hampshire is?
So the question revolves around when would we decide on extending or not extending the stay-at-home order. We'll do it before May 4th. We want to give people some flexibility and be able to plan on the stay-at-home order. And that also goes for whether we open up non-essential businesses, whether we got better CDC guidance and could relax the public gatherings stipulations, or whatever it might be. We know we've made a lot of very tough decisions and essentially closing things and clamping things up a little bit, and the state has reacted well to it. As we approach May 4th, we still have a little time. We will make a decision, and it won't necessarily be a thumbs up or thumbs down. Are we going with a stay-at-home order or not? There could be a new kind of hybrid model. Like we could look at it regionally. We could look at it for certain demographics, right? The vulnerable population we might have to be a little tighter with, and if there's evidence to say that the other demographic populations we can flex out a little bit more. So we're taking kind of some stakeholder input, but whatever we do is going to be done with public health as a preeminent decision point. We're going to run everything by Dr. Chan and the entire team, Commissioner Shibinet and the entire team at Health and Human Services to make sure we're not putting any decisions that we're going to make aren't putting anybody in harm's way. So we're still a little ways off from there. What is the date? April 16th? Something like this. Today the 16th? Yeah, I can't even keep track, to be honest. So we still have a little ways off. Maybe in the next week or so, something like that. We'll start. We're looking at a lot of different models and variables now, but we're still a ways from having to make a decision.
If you're looking at a hybrid model, how does contact tracing come into play? My understanding is that Massachusetts has a program where there's thousands of workers who are working on they've hired new people to specifically carry out contact tracing. How would that work in New Hampshire?
Yeah, I'll ask Commissioner Schmidt.
Thank you. We hired additional workers 4 weeks ago to do additional contact investigation, contact tracings, all of those things. So that has been going on in New Hampshire for several weeks now. So really looking at CDC guidance and everything that's coming out of our federal partners and even our local state public health that is further down the road in this pandemic. You will see consistently that contact investigation, contact tracings, meaning I've identified you as a positive COVID patient. I am now identifying and contacting all of the people around you to make sure that they are quarantined, to see if they have symptoms, and we're going to keep going from there, right? To really find that chain of transmission, as we call it. That is a very, very important component in this pandemic, and New Hampshire has been doing a great job on that from very early on. We did contact investigations on every positive case that we had, and we still do contact investigations on every single positive case that we get today.
Right, but also the standards for who can get tests have always been limited compared to what they could be given the availability of tests. So I'm wondering if we're looking towards opening up, looking towards a hybrid model, do you think that we've done enough contact tracing for people who may have it and may not have actually got a test for it?
So it's limited based on clinical indications. We have said right from the beginning that although these specific populations, we recommend that they be tested, we have always left the decision to test up to the clinical decision-making of the physician. So if your physician felt like you needed a test, for example, if you present with a low-grade fever but have an underlying condition of asthma, right, that would be a clinical indication of testing. But we, for the last several press conferences that we've had, we've talked about our expanded testing. We are now doing mobile testing in our nursing homes. We are Convenient MD has been contracted to do long-term care facility caregiver testing all across Rockingham and Hillsborough County. And today I announced Abbott ID testing through a partnership with the National Guard to go out and do community 5-minute turnaround testing, both in health care facility worker population and in the general public. We have a mobile test going on in Nashua on Tuesday for the community. So I think all along we've talked about our continued expansion of our testing, and all of that is predicated on the availability of supplies, right? There's always a limited factor somewhere, but what we're seeing with our big shipment of PPE get in, we took that off the table as a limiting factor. We're getting additional swabs. We have gotten additional test kits for the Abbott ID machine, although still not enough, just a small portion of what we requested. But as long as we have a steady, predictable flow of those testing supplies, we will continue to expand our testing in our communities.
Commissioner, on the 3 fatalities that were under the age of 60 yesterday, were there any underlying health conditions on those individuals?
There were, so the ones from yesterday. I don't have that information with me today.
Commissioner, CDC has changed the guidance with regard to probable COVID-19 deaths. We saw New York earlier this week, say 3,800 deaths they've added to their list. Is it possible that guidance is going to lead to additional deaths that were never tested as COVID ID, but could be probable COVID ID deaths?
I don't think that we have that same degree of an issue here in New Hampshire. I'm not saying that one may not crop up in the coming weeks, but we've worked very, very closely with our medical examiner to really create a plan around untimely deaths and whether those people get tested for COVID-19 or not. So it may happen, but based on all of the planning we've done, I don't suspect that it will.
Question for you, Governor, about the SBA loan program. Today it was announced that the Paycheck Protection Program has run out of funds to give direct support to small businesses. What can New Hampshire do in the meantime while Congress figures it out to get additional help?
So the question revolves around the fact that the Paycheck Protection Program, really the second SBA program that was released as part of the COVID epidemic, the first one being the first SBA was about $8.5 billion program. The second one now has run out of funds as well. They did a first come, first serve type approach to it. I have to be honest, I don't know if that's the best way to do it, but you had a lot of very large national companies coming in, having the lawyers and the banks and everything go after that money, and the frustration for a place like New Hampshire is a state with about 90% of our businesses are small businesses. A lot of them were left out of the mix, and so it's very frustrating. We want to make sure that Congress, and I spoke with, or I guess I was texting back and forth with Senator Hassan last night, we want to make sure that Congress is trying their best to do another round, whether it's through stimulus, they're calling it CARES Act 3.5, I don't care what you call it, but they're definitely, we're hoping that there's some additional funds there. In the meantime, we are in New Hampshire are going to be able to use our first round, the first pieces of the $1.25 billion CARES Act funding that comes to the state. A lot of that will be relief funding. So not that this money will directly replace the PPP program, and because that's a very different program, but a lot of it will also revolve around private small businesses, private nonprofits, hospitals, healthcare facilities. It's $1 billion sounds like a lot of money in New Hampshire, but it's really not when you add up all the different needs that are out there. Virtually everybody has a need. So we'll be able to implement something, I think, in very short order. We still don't have final guidance on how to spend that money, so we have to be careful, because if you put it out too soon, if you don't put it out before the rules are set, you can get in trouble with that. But as soon as that guidance is handed down, we'll be moving very quickly to start at least the initial funds flowing.
Do you anticipate that aid to be also directly related to payroll and paychecks? Because some have said that excludes some of the businesses that already have laid off, the restaurants, for instance, who have laid off a lot of their employees, and it's not of use anymore to have paycheck protection as much as it is.
So the question is, will our program work the same way as that revolves on paychecks, a paycheck type program? Not necessarily, to be sure. We're not looking to emulate it or copy it directly by any means. But for the specific reason that you brought up, you're unintentionally excluding a lot of businesses if they have already gotten rid of pushed a lot of people off their payroll. These funds are not just to make companies whole. These companies are to save businesses, save jobs, so that, again, as we get through this COVID crisis, they're alive and they can kind of keep moving forward, and hopefully the economy springs back strong and they can kind of ride that wind of the economy. Nobody's going to be made whole out of this in the short order. But if you looked at hospitals or you looked at restaurants, the metrics we use and the accountability that we use for each of those, there will be metrics and accountability, but they'll probably be very different, right? We could use a very different formula in terms of how we invest in hospitals or healthcare facilities, dentists and primary care physicians versus how we do it with restaurants, right? So we're looking at, that's what Gopher is really all about, looking at and engaging all these different folks at a stakeholder level and trying to figure out the best means, the most accurate way and the fairest way to get what funds that we can out to these individual organizations to provide not just some financial relief, but to actually save the company. One of the, if you have a company that needs $1 million or they're going out of business and you only give them $100,000, you've kind of thrown good money after bad. That company's probably still going to go out. So you have to make the decision, are we going to put in the $1 million and save them, or are we going to transfer that $100,000 to another business where that would be the difference between staying open and staying closed? Those are going to be some tough decisions to make. And again, really looking at not just what they want, but really what they need to stay open. And so we got to just be careful that whatever we're investing smart and for the betterment of the entire state.
Who makes those decisions?
Those decisions will ultimately be made by Gopher, by the Governor's Office for Emergency Relief and Recovery. Executive Director Jerry Little and his team, I met with them this morning. They're having a stakeholder meeting with the stakeholder advisory group that we put together. They're having that, I think, as we speak, or they've had it this afternoon. They're meeting with the Legislative Advisory Committee for a third time tomorrow. So they've been working all through the week and kind of putting a lot of this together. I think the stakeholder advisory group will be a very important piece of this, because that's where you can talk to the restaurant association, you can talk to those individual business sectors to find out what you can get a better assessment of what the needs are and start banging around some ideas of how to get it out in a fair and equitable way.
Do you know what percentage of New Hampshire small businesses were able to take advantage of the program?
I don't know what percentage. We'll get some. We just heard that the program ran out of money, I think this morning, something like that. So we'll get a final assessment maybe over the weekend, maybe early next week. It's really about, we'll have to go back to all the different banks and see what information is available. I don't know if the federal government can provide us that, but we can actually do it because all the programs are done through the banks here in New Hampshire, so we can get a decent sense of it here, probably.
You know, this week Governor Elliott and CMC both announced huge furloughs. Can you give a timeline for when you'd like to see hospitals be able to reintroduce some elective surgery in order to stem the mass?
When can hospitals open up elective surgery? We're working on that plan right now. We've engaged with a few different hospitals, not just the big ones, but the rural access hospitals, about what that would look like, right? We want to make sure that the citizens feel comfortable going in and getting that surgery, knowing that there's no possibility for infection with COVID. We want to make sure that those facilities that have COVID patients are segregating them off. We want to make sure that they're going to have enough PPE and supplies in a variety of different ways to provide those procedures. But hospitals on any given month during the first month, we estimate they lost somewhere in the realm of $150 million just here in New Hampshire because they could not do elective surgeries and procedures. So they're also probably the most equipped to get up and running because they are so equipped with PPE, because they have that expertise. They're on the front lines of this issue already. And they provide a direct and immediate need of service to the citizens of the state, whether it's an elective procedure or a required procedure. I mean, they're right on the front lines for us. And so our hope is to create a model, working with them to get them back up and running in some new fashion, in some way that gives the public the assurance and the trust that when they walk in, there won't be an issue with the COVID virus.
Governor, we're starting to see some cuts at the Department of Health and Human Services, state money that is being cut out of programs transferred because of this. So you have $8 million that has been taken away from planned increases for SUD facilities for rates. You have $4 million of the state loan repayment program. $8.7 million has been cut from the state psychiatric unit, which is basically all of its budget in the next 2 years. Is that money coming back, or is that gone?
So the level of budget impact that the state will see between now and just the end of June is probably on the order of $200 million. And then from June of this year to June to next year, you could be looking at $250 to $500 million more dollars. None of this CARES Act money is designed right now to come in and replace any of those revenues. There will be massive budget cuts across the state. These are some programs they are outlining where we could make those programs weren't put into place yet. They were discretionary programs, if you will, programs of high need, of course, but also discretionary with some flexibility to be able to move things around so we could have cash flow flexibility to institute, for example, the hospital fund that we set up to protect hospitals, or the dollars we needed to go in for sexual and domestic violence or victims of child abuse, those prevention programs we needed. So we transferred a lot of that money around with my executive authority to back up the areas that were just of the highest priority. If at some point down the line Congress or the federal government allows some federal money to come in to replace certain funds, there's a possibility that some of those projects could come back. But we're going to have to make a lot more very deep cuts across the state when it comes to how we spend dollars, and we're already well underway of looking at the opportunities there, but it's going to be pretty drastic.
We talk a lot about the legislative role in this versus the executive role, but we talked about it in the context of the legislative role in spending federal stimulus money. We haven't talked about it in the context of making cuts to state money and cuts to aspects of the state budget that were passed last year. So I guess, is this philosophy the same, that this executive order also gives you the authority to decide which programs are cut without legislative approval? And is that going to be the process for the next few months?
Yeah, so just looking at the budget, the executive order, just even taking the executive order aside, the governor always has the ability to manage the budget as necessary. So.
But if you were to cut $8.7 million from the Secure Psychiatric Unit Hospital, you would have probably had to go through fiscal in a non-emergency setting, correct?
I'm not sure. I got to be honest. I haven't even thought about that process right now. We're just looking because the scope is so big. But no, look, I've always said when it comes to budget, traditional things that the legislature should take up, that's absolutely what the fiscal committee and the legislature should be doing on bills and all of that kind of stuff. The COVID crisis is completely separate, and it needs and demands moment by moment ability for the governor to act. There's just no question about that. The examples are almost countless at this point, given just in the past 5 weeks what we've had to do and what we've been able to do to provide relief, recovery, and opportunity for individuals of the state on a moment's notice. So when it comes to the budget cuts, we'll be including the legislature in that process. I can absolutely guarantee that. We're looking kind of at a very macro level, trying to get an assessment of how big of cuts we're talking about, 10, 50, 100 million. It's way beyond that now. We really appreciate it. It's well beyond that. So given that reality, we'll probably put a large list together of various programs that are going to we're going to have to just take a very tough look at.
Okay, this is my last question on this. You've talked about the Gopher, you've talked about transparency with the Gopher and how it's making these decisions. And yet, this is a lot of money that has not had very much transparency in terms of why the SBU was cut, why the substance use disorder money was cut. These cuts have already happened, and we haven't seen a process right now as to why this program versus this program has been cut. So what is your guarantee that future cuts which are necessary as the budget contracts are going to be more transparent?
Well, look, those dollars were moved on a moment's notice because they absolutely had to be moved. The legislature decided not to be in session. They went away at the beginning of I guess it was beginning of March. So they weren't even in session, so we moved those dollars to protect the hospital so doors could stay open. It was the absolute right thing to do. And so those programs had a lot of those programs that you're talking about, the dollars hadn't been spent yet, they hadn't been put out yet, they hadn't been encumbered or allocated, so we had the flexibility to use them to make sure hospital doors were going to be open, given we were dealing with a worldwide pandemic. So as we go forward, we're going to take a harder look at different programs. Existing programs that are out there may need to see some cutbacks, and not just in health and human services, but across all of state government. There's very few sacred cows, unfortunately. I can tell you from a personal standpoint, when it comes to programs dealing with DCYF, with child abuse issues, domestic and sexual violence, these are things that, for me, shouldn't be really touched. If anything, you have to, in times of economic crisis, you have to amp those programs up so you don't get yourself into long-term trouble. That's what previous administrations did. They ignored, they started cutting everywhere, and it had repercussions years and years later, and we don't want to put ourselves into that position. We had a budget of approximately $12 billion in my first 2 years here. We had a budget of about $1 billion more just last year. So there is room there. There really is. Not that it's wasteful spending money. No, we have a lot of needs in the state. But there is room there to make some tough decisions, to be sure, but the right decisions to make sure that from a cash standpoint, we do have a balanced budget amendment here. And at the end of the day, after the budget is passed, it is up to the governor to ensure you're balancing that budget. And it's exactly what I'm going to do.
homeless population. Is the site, I believe in Laconia, is that up and running yet? And are there people there? Yeah.
Yeah. So let's take a step back. The issue around the homeless population and the reaction that the steps we've had to take as a state to look at both quarantining and identifying individuals that may be COVID positive and making sure that they're segregated. In the past few days, we've had a lot more incidences and cases where the state has had to get involved. We always want to defer to the locals, those local communities, to find ways to segregate those populations, make those decisions, manage those individuals if they have to be quarantined or they're COVID positive, to make sure that they're not continuing to potentially spread the virus or be contagious out in the community. But the state and the Emergency Operations Center and Perry Plummer, I think, has done a very good job looking at various options across the state that we could work with. Now, from a practical standpoint, there's always kind of stumbling blocks there, right, in terms of making sure that the service is going to be there, the security is there, what happens if individuals don't choose to abide by the quarantine, how are we going to enforce it. You know, we're trying not to have a heavy hand in this, but public health and safety has to be preeminent. And Perry Plummer and his team, I think, have done a very good job working with not just Manchester. Chief Goonan, I think, has done a very good job in Manchester. Him and Perry have worked very closely. Perry's been working out in Keene, has been working in Laconia, making sure that whatever options are available are truly available and that they can be managed and implemented appropriately for the homeless population. The site in Laconia specifically that you're asking about, it's available to us if we want it. We've kind of run by the plan and the idea with the mayor and the chief of police, and they're all set. You know, we have a robust, I think, program available to allow the security of that location and the safety of those individuals. But you know, as these things sprout up, and it's not just today, there's gonna be issues with the homeless population and COVID over the next few weeks and maybe even over the next few months. So we always want to defer to the locals, but the state is there for a backup.
Do you have a ballpark on how many transient people are infected at this point? I mean, in terms of the population you're dealing with?
I'm looking to the commissioner. I don't off the top of my head. I mean, we could probably get some round number for you. I'm going to ballpark it and say a handful, a dozen, something like that. And those aren't infected necessarily. Those are also folks that we're looking to quarantine, and they're really from all over the state potentially. Yeah.
How is the mental health community faring through all this in terms of clinicians being able to?
Yeah, so the question revolves around how the mental health community is faring. Very interesting. You know, a lot of services in the state are simply not being utilized at the rate that they probably should be utilized, and mental health is one of those. People aren't seeking out mental health services at the rate that they were looking for prior to the COVID outbreak. What that means is that a lot of the community-based mental health systems, very good systems, they don't have the clients coming in, and they're not billing out, so therefore they're not necessarily receiving the revenue. So we've worked out kind of a system with the managed care organizations, the Medicaid managed care organizations, the MCOs as we call them, to help find a better pathway forward so that through this crisis, those community-based mental health facilities aren't going through the revenue crunch that a lot of other folks are seeing, because we basically pay a lot of money into those MCOs for them to disperse back out and manage with the mental health organizations. We've put a lot of money into it, but we don't see a lot of utilization. So we're finding a balance there, and the MCOs, I think, have stepped up in a good way to allow that balance. But on a bigger picture, where there's mental health services, behavioral health services, opioid-based services, we're not seeing the use of the system over the past month and 6 weeks that we were prior to that. It's a bit concerning because, you know, those issues are still there and you want those services to be there, but the citizens aren't reaching out. So that's why I'm just going to keep going back to the example that we really tackled, which was domestic violence and child abuse issues. We put funds in there, we ramped up our efforts, we made sure that those prevention programs were robust and we could go out and be proactive about it. When we may have to do that with some of those other communities to make sure that we're proactively reaching out and making sure that people are getting those services, maybe in a different way, whether it's through telemedicine or remote health opportunities, or in certain situations where they can come in and just have a safe one-on-one interaction depending on what the case may be. So it's an interesting dynamic, and we're keeping an eye on it very closely. I think we have some on the phone. Do we have some on the phone?
First question comes from Holly Raymer with Associated Press. Holly, go ahead with your question.
Hi, thank you. I have a question about personal protective equipment. Did New Hampshire have its own stockpile of PPE or medical equipment before the emergence of the new coronavirus? If yes, what kind of items were in it, and generally how old were they? And if no, did New Hampshire at some point have that kind of stockpile, but it ran out, or
Sure.
things became
No, good. I
obsolete?
was about to take the question, and then you got into a granular level of detail. And when I have a commissioner here, I'm gonna let Commissioner Shibinette answer. So, Commissioner, thank you.
Thank you. So New Hampshire did have a cache of PPE right from the get-go. We've always maintained a small cache. So in all of our emergency operation plans, there is both the indication that the state is going to keep a small stockpile, but then very much rely on the strategic national stockpile for anything more than, let's say, a week. And I would say that our small stockpile, we probably went through in the first week of this crisis. We had everything in there from N95s, masks, gowns. We had ventilators, all of those things. So when we, went into the cache, we went through the process of any equipment that we have, like we had 60 oxygen concentrators. Make sure that they're all working, that they've all had the preventative maintenance that they needed. So we went through all that. Same with the ventilators. A couple of our ventilators needed to go out to have tune-ups. We did all that. So everything is back and in working order from an equipment standpoint. But the cache that we do develop and we maintain during non-emergent times is, I would say, a week to 2 weeks, depending on the scope and the severity of the event.
The next question comes from Lloyd Jones with the Conway Daily Sun. Lloyd, go ahead with your question.
Well, thank you. Hi, Governor Sununu.
Hi.
Thank you for all you're doing for us folks, and just wondered if you could talk a little bit about campgrounds. There's a great concern up here in the North Country about campgrounds opening and the fear that goes along with those opening.
Sure. So right now our original plan has been to keep campgrounds open, but we are listening to a lot of the constituents on both the public and private side of folks that might own them, as well as the communities that they reside in. I know there's a lot of concern that by keeping campgrounds open, we're going to be encouraging a lot of folks from out of state to come up and again, kind of driving that vacation tourism a business that we aren't really looking for right now. So what we're doing is we're putting together a guidance document for both, again, the public and the private sector that hopefully can work to allow the campgrounds to stay open, that can allow it to do it in a safe and equitable manner across the state, understanding that, again, they are outdoors. We're probably going to limit the number of tent sites that are possibly available at a single campground. We're going to limit how far apart they can be. We may have to shut down certain tent sites to maintain that physical distancing. We're going to make sure that we do it through a reservation system, and so we have an appreciation of that. If we can do that and it can get up and running in a safe way, then we can keep the campgrounds open. If we look at that guidance and it's still not where we want it to be with public health, and we can't ensure that public health isn't going to be negatively impacted, then there's still a possibility that we have to pull the plug and close down the campgrounds. We don't want to do that. We're not. It's still April. Usually, the campground season on a rough spoke starts around May 1st. So we're trying our best to come up with a guidance document that everyone can not just be happy with, but we can work with through public health to ensure the public health and safety of individuals in those communities. We think we can get there, but we're going to be very cognizant of the response we hear from those communities and that feedback. And if we have to make a different change, a different tact, we can take a different tact.
The next question comes from Paula Tracy with In-Depth. Paula, go ahead with your question.
Good afternoon. I'm interested in the upcoming call you have with the other governors of the country and what you're listening for advice or what advice you might offer about successes we've had in New Hampshire.
So the question is about the upcoming call. In about 10 minutes or so, I'm going to be on a call with the president, the vice president, and most of the other governors across the country. I speak with a lot of the other governors across the country multiple times a week since this epidemic actually broke out. Been talking to governors, definitely regionally. I talk to whether it's Governor Baker, Mills, or Scott in the vicinity on almost a daily basis. We're texting or calling all the time. I talk 2 or 3 times a week. I'll have calls with the National Governors Association. I'll have a call call with the vice president and the other governors. I'll have a call with East Coast governors. We're always, almost every night and every day, there's some call with lots of governors. And we're always batting around ideas. These are folks on the front lines. It's one of the best resources I have to kind of giving out what we've done here successfully and listening to their success stories and taking that and translating it into some type of operational success for the state of New Hampshire. On the calls with the president and the vice president, I'm always listening to what opportunities might be available, what the tone is, recommendations from CDC, what they might be seeing out there in terms of testing, their capabilities of increasing testing opportunities for us, their ability to increase PPP opportunities for us, what's going to happen with FEMA, the National Strategic Stockpile, what's going to happen potentially with future legislation, with a stimulus bill, with the CARES Act 3.5. There's a lot of different things coming out of Washington, D.C., and not only are we listening to that, but they do usually allow us to give some feedback and ask questions. And as governors, I think we try to be cognizant of people's time, but there are answers that we do want to hear, and there's specific questions that we all have. So there's a lot out there, but a lot of times I'm just trying to listen when the president and the vice president are there. But when we have to challenge the system or ask for additional help, we're always willing to do so.
The next question comes from Michael Graham with Inside Sources. Michael, go ahead with your question.
Yes, Governor.
Yes.
Yes, Governor. The $250 billion that could be poured into the PPP right now, still sitting in D.C. You mentioned that you hope the state might be able to do something with the $1.25 billion. The New Hampshire Bankers Association said today they're going to try to keep doing what they can. But given that New Hampshire has the 6th highest increase in unemployment year to year, that's one of the hardest hit states, is there a solution other than this refilling the PPP funds? And are you satisfied that the New Hampshire delegation is doing enough to get the Washington to push past the partisan politics and get the money here where it's needed?
So there's a couple parts to that question. One is the PPP program. A lot of folks are getting approved with they put their applications in a week or two ago. They're getting approved now, and hopefully those funds will start actually rolling out. I'm not sure when those checks are. It's folks apply through their bank, they get approved. It comes directly through the federal government and through their bank. They can get those loans. So my sense is those dollars will be flowing very, very shortly. On the unemployment insurance, remember if I may. The statement was that New Hampshire is the 6th hardest hit state in terms of unemployment insurance. One of the reasons that looks like that way is because I expanded our unemployment insurance program before anybody else did. I created opportunities that no other governor had even done yet, way before the federal government came in. And it was great that the federal government came in and kind of stood behind us, but I had opened up those doors long before anybody else, so we've just had the opportunity much longer. There's no doubt we are hard hit here, to be absolutely sure, but as is everybody across the country, so it's not about ranking one state versus the other. Everyone is hard hit, pretty much everywhere. There's very few businesses. I think the estimate was about 10 to 15% of businesses will actually see an increase in business over the course of this COVID pandemic. The vast majority of the other 85% will see not just a decrease, but many of them will simply go out of business. I think the delegation has been doing a good job advocating for funds to come in here, whether it's through the PPP program, whether it's through the CARES Act, whether it's through getting additional funds to help backfill and supplant some of the massive amounts of lost revenue the state will have, the ability to use CARES Act funds at a city and town level, the ability to have flexibility with the CARES Act funds. A lot of that came through that legislation, and I think not just our delegation, but most delegations across the country did a very good job in making sure that the flexibility, it wasn't a program that would just had traditional Washington stipulations. It was a program that allowed states to be flexible and be cognizant of the needs of their businesses, their nonprofits, and their citizens. So, we're going to keep pushing, of course. We're going to keep pushing as hard as we can to get some of that financial opportunity with the flexibility we need so that we can decide how to spend those funds and move forward very, very quickly. Speed is of the essence, as we've always said. And again, I met with the Gopher office today and Jerry Little and his team, and I think they're looking at ideas in terms of just not just how to spend it, because we're not going to spend every dollar on day one, but knowing that we have till December 20th, and knowing that we don't know what the economic impacts of the state will be in June or September or November. We really need to space this out a little bit so that, again, we can utilize the flexibility that Washington is giving us to the best of our ability to be responsive to the needs of the state.
The The next question comes from Rick Green with the Laconia Daily Sun. Rick, go ahead with your question.
What is your message to people from northeastern urban areas, including viral hotspots, who normally visit here during tourist season? Would you encourage them to stay home this year?
Absolutely. If the question is, if you're from a northeast urban area, you're talking about like Boston, New York, Worcester, places like that, right? You mean northeast United States, correct?
Right, just urban areas in general, including places like Boston and New York.
Look, we all have stay-at-home orders, and you are healthier at home. You're healthier at home in New Hampshire. You're healthier at home in Massachusetts. You're healthier at home in New York. You should stay there. You should be with your family. You should keep yourself in a position. At some point, we want people to come back into New Hampshire for tourism or whatever it might be, but not now. Not now. This is really about staying at home, staying healthy, abiding by those stay-at-home orders. Those are very tough orders, and we take them very seriously. But if you have to come out for work, you have to come out for groceries, you have to come out for exercise, of course, we get it. But other than that, you should be staying at home. This is no time to be vacationing necessarily into the White Mountains of New Hampshire. As beautiful and terrific as they are, this is a time to be home in your home states and staying healthy.
The next question comes from Abby Trombley with Monadnock Radio Group. Abby, go ahead with your question.
Hi, my question is actually for Commissioner Shibanez. In yesterday's Gopher call, you mentioned that you feel okay about where the state is right now for ventilators, but a surge in any particular region could present a problem with that. So I was just wondering if you could elaborate on what the state would do in that situation.
Thank you for the question. So in yesterday's call, I mentioned that, with our current numbers and the current place the state is in, I'm okay with the number of ventilator type machines. Ventilators, but also BiPAPs and CPAP machines, so that as we learn more about this virus, we'll be prepared regardless of what the treatment modality is. We have ongoing counts of every hospital in our state on how many ventilators are in use and how many are available. If we needed to move ventilators around or provide the hospitals with additional ventilators, right now we are in the position to do that. If we have a surge beyond what we've even predicted, even at our highest number that we predicted at this point, we have enough equipment in our state to do okay with that. If we went beyond those current models and those current predictions, we would have to either procure more ventilators, which we are in the process of doing now, or move equipment throughout the state to allot for that surge.
The next question comes from Todd Bookman with New Hampshire Public Radio. Todd, go ahead with your question.
Yeah, Governor, I want to ask about the lawsuit filed against you by state Democrats over who had the authority to spend the $1.25 billion. Given the short window before the money arrives, like for April 24th, I'm curious, why did you request the delay in the hearing that was supposed to be scheduled for tomorrow?
Sure. So there's an immense amount of information and, frankly, evidence that points to exactly why the governor is given the authority very clearly in the 2002 a law that was passed exactly as it, and we're following it exactly as is intended. We have a lot of information. We simply wanted to make sure the judge had all weekend to review that information and ensure that we're going to get the best decision from the court. I think we have two more. I got to be a little bit quick, so we're going to rapid fire them if that's okay.
The next question comes from Harrison Thorpe with the Rochester Voice. Harrison, go ahead.
Yeah, hi, Governor. With Massachusetts being a COVID hotspot, can you see New Hampshire opening up ahead of that if, say, Vermont and Maine were in agreement?
There are various, it's not about being open or closed. Everyone is talking about open New Hampshire, open. It's not about that. There are various aspects of our economy, of our society, that we can probably flex open step by step in a phased approach with public health always in mind. And if Vermont and Maine and New Hampshire on certain aspects are moving forward in a regional approach and it makes sense, then we absolutely could do that. Massachusetts is tougher given what a hot spot they are, but no one is in lockstep with each other. No one, one state can't go forward when another doesn't. But it just makes more common sense and practical sense for the citizens if we're moving in some type of regional approach. So that's always on the table. But again, it isn't a thumbs up or thumbs down. We're open, we're closed. Absolutely not. We stepped into this, and we have to be very careful as we step out.
The next question comes from Rick Juergens with the Valley News. Rick, go ahead with your question.
A quick one, Governor. I just wanted to ask you if you have a moment to pause and step back and look at the COVID situation. What is the area that gives you the greatest concern? Where do you see a point of vulnerability that still worries you?
Boy, to step back from the COVID situation and find out what is the areas of biggest concern in the most vulnerable area. I got to tell you, it still really revolves around both geographically in the southern tier, given our connectivity to the Massachusetts border and the transmissivity of our lifestyle, frankly, across that border. But the long-term healthcare centers, right? These facilities that do great work taking care of very vulnerable citizens, many of which are either elderly or have other compromising health conditions. Preventing outbreak in those facilities is incredibly difficult. I mean, really, really difficult, and obviously the area of highest concern, and will remain an area of incredibly high concern, not just in the short, but probably in the long term as well, until a vaccine is truly found, because it just takes one individual with asymptomatic transmission, because we know so much more now than we did even a month ago how rapid asymptomatic transmission can happen. You could have an entire facility without a sniffle of the nose, and you could have dozens of people spreading COVID and they wouldn't even know it. But you find out very quickly when it hits that vulnerable population, the mortality rate can be incredibly high. It can be a very tragic situation. And so that's one that has already hit us very hard, and my unfortunate sense is going to continue to hit us hard as we move forward. Okay, well, we thank everybody for joining us. I do have to join the governors on the call, and we'll likely do another one of these tomorrow, as we always try to do. Be very transparent. Be safe, everyone. Enjoy what is a little bit of the nice weather. Get out, stretch your legs, get some exercise, but please understand the stay-at-home order is in order. It is in effect. You are healthier at home. We had another 70-plus cases just today. That viral spread is real. The asymptomatic viral spread is real. Let's be cognizant of that, and if we stick together, we find that those positive moments in our lives as a community, there's no doubt we can move through and get this thing together. Thank you.